Morning everyone, Dr. Doodle Dad here. Today I'm going to be talking about gout. I'm going to tell you what it is, and then I'm going to tell you some things you can do to try and prevent it, or if you already have it, to try and get rid of it. So let's get on with the video. Nice. So thanks for joining me out for another run in the battle of man versus running. I'm afraid this might be one of the ones where the run wins. Oh, very windy, uphill, hasn't been nice, but I'm sure the downhill will be fine. Anyway, so today we're talking about gout, and the reason I thought I'd bring this up is this week I've had 3 people come into the practice who've all got gout. They didn't know they had it. They had, in one case, aching joints just everywhere. In the other 2 cases they had more of a classical painful toe joint, and that's one of the commonest presentations of gout. Very painful. Anti-inflammatories are what people tend to take when they've got it, but then after it goes away it usually comes back. So what is gout? Well, I guess gout used to be called the king of diseases and the disease of kings, but it isn't anymore. In those days, when it was first discovered and named, it was people who were eating chicken livers and drinking port and things like that, and all of those foods contain what are called purines, and purines in high enough volume in someone susceptible to gout will end up in what's called your uric acid levels rising, and that might put you into an episode of gout. So what's uric acid? Well, uric acid is the thing that gives urine its name, and I guarantee if you ask any doctor what's uric acid for, they'll sort of scratch their head and say it's involved with gout. Certainly that's what I would say, but that's not the whole story. There's a very interesting book called Drop Acid by a guy called David Perlmutter. I'll put it here, okay? You can have a read of that. But basically gout, uric acid is an inflammatory marker, and it goes up when we're inflamed. And one of the things that causes us to be inflamed is foodstuffs. Now unfortunately in this day and age, there's not many people drinking port and eating venison and things like that. But there are lots of people eating an inflammatory diet. So the SAD, Standard American Diet, or Standard Western Diet, is full of highly inflammatory foods, and they all can cause us to end up having high levels of inflammation. And one of those inflammatory compounds which rises is called uric acid. And as I said, if you're susceptible to gout, you might be one of these people where those crystals decide to that compound decides to crystallize out of the bloodstream and end up in the joints, and that's what happens in a flare-up of gout. Now the way I would describe gout to most people is, imagine if you've got like a nicely oiled door hinge that works really nicely, really well and smoothly, and someone comes along with a handful of sand and chucks it in the grease. Suddenly that door hinge doesn't work very well, and that is, in your bones, and certainly in your joints I should say, is extremely painful. So that is sort of the basic mechanism of how gout happens. So high inflammatory lifestyle, followed by crystallization of the uric acid out of the blood into these little crystals, and then into the joints, or most commonly a single joint, and it's where it gets its name, a crystal arthropathy. So that's how you get it. That's kind of describing what the symptoms are, I hope. And you usually end up at the GP. They'll give you one or 2 things, some strong anti-inflammatories or something called colchicine, and those will reduce the inflammation and help you feel a bit better. Just going to quickly show you where I am. Look at that. That's lovely, isn't it? So I think that's what's called Tyne water, which is a tributary that leads to the Tyne. What? Oh sorry, my mistake, Gifford water. I have my accountability buddy with me, who's also struggling on this run today. And that runs down, and I think that eventually joins the Tyne and runs through East Lothian out towards Dunbar. But we've just come up that path there. Very nice. That's where I filmed my jump to light speed video 2 years ago in the winter. Anyway, so that's gout, what it is, how you get it, and how it presents, and what the GP might do for you in an acute flare-up. Next, I'm going to tell you about how it's managed long term, or even how to prevent it altogether. Gosh, really don't have anything in the tank this morning. Anyway, let's get going. So, let's say you turn up to the doctor's, you've got a sore big toe, and it's pink and it's really painful to walk on and you're limping, and the doctor says, well, I'll give you some anti-inflammatories and then come back in 2 weeks time for your bloods. Now the reason he doesn't do the bloods then is because all of that uric acid is in the joint, it's not in your blood, so you need for the flare up to disappear, and then it all goes back out into the bloodstream and your levels will be high. And so you get those bloods done and it shows, yes, sure enough, your uric acid levels in your bloodstream, your serum urate is high, and that would be a diagnosis of gout. So you then get two options where they say, do you want us to treat you or not? And normally I would say to someone, if you're having 2 or more flare-ups a year, they're so painful and so disabling that if you're having that many or more, then we would consider putting you on a thing called allopurinol, and allopurinol prevents gout flare-ups. It's a bit of a tricky thing to put you on because it's usually got a titration over 6 weeks. That means we build it up over 6 weeks, but it can also flare up a gout episode. So in that 6 weeks, you also have to take an anti-inflammatory. And while you're taking that anti-inflammatory, it might upset your stomach. So you also have to take something to protect your stomach. Domino medicine, as I call it. Anyway, that's one way to treat it. And you may stay on that for several years. You probably have your bloods checked once a year just to check your levels are okay. And if they're a bit high, you might get told to increase your dose slightly. But that's the usual treatment for someone with, let's call it chronic gout. So 2 or more flare-ups a year. Now the other option is, can you do something with your lifestyle? And the answer is yes, because the GP will also sometimes hand you a sheet of what are called high purine foods, and they'll say avoid these and that'll help your gout. And purines are one of the precursors that lead to uric acid in your bloodstream. So if you don't have much in your diet, you're not going to have much going into your bloodstream. The slight problem with that theory is that, as I said at the start, there's no one really drinking port and eating tons of venison and red meat 6 times a week and things like that. And yes, it's still good to cut those out. You know what? I'm gonna have to wait till I get to the top of that hill. I can't run today. Oh my god, it's so difficult. I will finish the run and I'll finish this video, but some days the run just wins. I'll see you at the top and then I'll continue blabbing about where was I? Purine foods or something, wasn't I? Okay, I'll see you in a few minutes. There seems to have been some storm damage here, so here we go. Now, I'm not really sure how I'm going to get down the other side actually. There. Yeah, look at that. Yeah, don't know how I'm going to get down from here. I guess I'm going to have to go around that one instead. It doesn't look high, but it's very, very high. Look at these bricks and the trees, what do you call it? Root system. Oh. Right, so that blooming hill is out the way, thankfully. I had to take my hat off, it's sweating. So I was telling you about purine foods, and your GP quite rightly will tell you to avoid them. But as I mentioned, the Western diet is full of inflammatory foodstuffs, and if you think of, there's that thing again, jeez. Anyway, if you think of inflammatory foodstuffs as potentially raising your uric acid levels, then you should get all of them out your diet. And that would mean moving towards more of what's called an anti-inflammatory diet. And I do try and tell people about this. Get a few blank stares. But what I'm really meaning is maybe move to something that's more Mediterranean. It's got more naturally occurring vegetable oils like olive oil and things like that. You've got some fish in there, but also you've got loads of fruits, vegetables, nuts, beans, seeds, legumes. Legumes are things like peas, chickpeas and things like that. And those, well, first of all, they don't contain much uric acid, but they also help reduce your blood levels of all kinds of inflammatory things. So if you've got an inflammatory illness, whether that's rheumatoid arthritis or any of the itises, have a think about that, because it might be your diet that's contributing partly towards some of your symptoms. And if your goal is to reduce your medication intake, which is what I feel everyone's goal should be, safely of course, then consider how you could change your diet to help with that. So I hope that's helpful. In a nutshell, gout, crystal arthropathy, which means uric acid crystals build up in the joints. It's very painful. You get put on medications to either reduce the inflammation in an acute episode or prevent build up for chronic gout. And you should avoid purine containing foods, but also consider an anti-inflammatory diet. And read Dr. Perlmutter's book, which I've found really helpful, and a few of my patients have as well. Some of them have come off their medicines as a result of changing their diet. So anyway, I hope that was useful, and I'll see you in the next video, hopefully in a flatter run that I can actually manage without busting a gut and trying to speak at the same time. So apologies for that little ranting interlude in the middle. Nice one.